Dental implants have made an enormous impact on the services dentists can offer to patients. Until recent years, never before has replacement of missing teeth been so successful. If adequate supporting bone is present, it is now possible to place dental implants into a patient's mouth, followed by an appropriate artificial tooth, allowing the patient to appear and chew in a completely normal manner. This presentation describes dental implants, demonstrates how they integrate into bone, discusses the research on their success, demonstrates the implant placement procedure, and offers alternatives for you if implants are not your choice for replacement of your missing teeth. Many years ago, it was accidentally discovered that when titanium is placed into bone, the bone grows into the titanium. The bond of bone to titanium is so strong that the implanted titanium may be used to anchor teeth and afford normal chewing function and a beautiful aesthetic result. The variety of screws and cylinders you are observing are commercially available dental implants. Each shape and size has been designed for specific purposes. Your dentist can explain the type of dental implant that best suits your own personal needs. A dental implant replaces the root of a missing tooth. It is anchored into bone very strongly after a few months of bone healing, the completion of which process is called osseointegration. After the implants are securely in bone, artificial teeth, crowns, bridges, dentures can be supported by the implants. Some implants can be used immediately after their placement, while others require a healing period before loading with artificial teeth. Dental implants support crowns, you may call them caps, bridges, partial dentures, and complete dentures. The artificial teeth placed on implants may be fixed into the mouth or removable, like a denture, to the patient. The following images show fixed and removable types of implant-supported artificial teeth. You are observing an implant and one single crown or cap cemented onto it. The patient will not have an ability to differentiate the artificial tooth from the other teeth after a very short time. Now you're observing 4 implants supporting a fixed metallic bar, the 2 dentures, including the lower denture with gold clips that attach to this fixed bar, the removable dentures in the mouth, and most importantly, the appearance of a completed denture situation in a very happy patient. Your dentist will advise you about the various types of implant-supported dental restorations that will best suit your needs. Both the fixed and the removable forms are well accepted by patients, and overall, patients prefer the implant-supported restorations to the conventional ones. For several decades, implants have been placed successfully virtually around the world. Millions of dental implants are serving today. You're observing a full upper implant-supported fixed bridge. You don't see the implants. They're underneath that upper bridge. It has served well for 20 years and it's still functioning well. The international research shows that about 95% of dental implants survive and integrate into the patient's bone. Only infrequently does one fail. Artificial teeth placed onto the implants have a predictable service life of many years, but similar to most other mechanical items, they wear out, requiring replacement of the implant-supported artificial teeth, but not the implants. They're okay. Usually, the implants remain in service to again support a newly made set of teeth. Placing screws into bone sounds like it should be a painful procedure, doesn't it? However, when placed with either a local anesthetic or under sedation, or when using general anesthetic, the procedure is relatively painless. In simple implant placement procedures, some patients do not even take the pain medication after the surgical procedure. The following images will show you the placement and restoration of single implants for missing teeth in a young woman. 4 months previously, the patient had 2 implants placed in the locations of the missing front teeth. The implants are now integrated into the bone and are visible in the missing tooth areas. Some dentists prefer to load the implants with the artificial teeth immediately after implant placement, while others wait a few months. As you see, the implants have been extended into the mouth with what we call abutments. These metallic abutments have been placed into the implants. The crowns or caps will attach to the abutments. Some abutments are ceramic rather than metal. During the fabrication time of the artificial teeth, which is several days, the patient has tooth-colored temporary restorations in place. Crowns or caps have been cemented onto the implant abutments, simulating the natural teeth on each side. These implant-supported crowns look like teeth, feel like teeth, chew like teeth, need cleaning like normal teeth, and the patient will gradually forget that they are not really natural teeth. The happy teenager you just observed has benefited from the miracle of dental implants. Her 2 artificial teeth will serve her for many years. But some patients cannot have implants because of too little bone, financial constraints, overall health challenges, and other problems. What are the alternatives to implants? There are a few alternatives for those patients who, for some reason, cannot have implants. Please discuss the following alternatives with your dentist. You may be someone who would be better served by conventional therapy rather than implants. The most commonly used alternatives for implant-supported artificial teeth are fixed bridges. They require preparation or trimming of the teeth next to the missing tooth. They're cemented into the mouth. When one tooth is missing, they cost about the same as an implant and a crown. The least expensive alternative for implants and crowns is placement of removable partial dentures. These appliances restore normal appearance and function relatively well, but fixed bridges or implant-supported crowns usually have better patient acceptance. Dental implants are the major innovation in dentistry over the last 50 years. You've seen alternatives for dental implants, some of which were not that desirable. Dental implants provide function and beautiful aesthetics very similar to natural teeth. Not all patients can have implants. Please talk to your dentist for further suggestions relative to your specific situation and whether or not you can have dental implants.